Hi, everyone, and welcome to another episode of Wellness Day, a podcast coming to you every Wednesday here from the Jahangir Wellness Center. My name is Kavas Jahangir, and here from the JWC studio today, I've got a very special guest. I've got Dr. Ashwin Porwal here from Healing Hands. It's a known name here in Pune and now far, far beyond. He is the leading surgeon and founder of Healing Hands, which is predominantly in proctology and many, many other things. So, thank you so much for being here, Doc. It's a pleasure to have you here.
Thank you so much. Thank you for having me here.
So, as I said, the Healing Hands, a very known name now here in Pune, especially in proctology. Why don't you tell us what is proctology and what is it that you do?
To keep it simple, it's anything which has to do with the bottom diseases.
Right.
So, proctology means someone who specializes into piles, fissures, fistulas, and incontinence, chronic constipation.
Okay.
That's what proctology is about.
So, if someone comes to you and says, I have a pain in the you're the one who sorts it out.
Yes.
Okay. So, that is in a nutshell.
Yes.
Right. So, things like piles and fistula, what is that exactly? Because it's a very known thing that people talk about. But what are the most common ones that you deal with?
I think the trend is slightly changing. From piles now, the common one has become fissure, which is in young age group. But typically for a layman, anything in the bottom,
Yeah.
any kind of pain, discomfort, even if it is burning, itching, pricking, or bleeding, people usually name it as piles.
Okay.
And that's the mindset they have. And most of the patients, before they consult a doctor, they would like to treat themselves on either home-based remedies or some treatments available over the counter, considering that they have piles.
Okay.
But there's a range of diseases, and I think that's for the reason that it should be diagnosed correctly.
Yeah. Well, yeah. Let's actually take a step back and why don't you tell us how you got into this particular field as well?
Very interesting one. So, while I was doing my surgery, I used to tell my friends that I would like to do something for which I am the best. I am the best at. And obviously, my favorite hero is Shah Rukh Khan.
Okay.
And I always used to tell my friends that if I have to do ever any treatment, even if it is a nail removal, and if Shah Rukh wants to do it, and if he thinks of top 10 surgeon in India,
You should think of
I
you.
should be one of them.
That's actually a nice way to do it. Good.
So
aspiration.
I was kind of obsessed that I should do something to the extent of perfection with what I do. And while I was doing that, I realized that proctology was one area which was totally ignored, neglected,
Yeah.
not only in our country but across the globe. It's a specialty which is still evolving. So I think I just started at early age in 2008, and that's when I started this concept of holistic treatment towards patients suffering from piles, fissures, constipation, wherein we introduced the concepts of plant-based medicines
Okay.
and offering them minimally invasive surgical treatment options
Right.
through lasers.
Interesting. Okay. So, yeah, let's actually get deeper into that holistic side because that's, as you know, what we do here at the Wellness Center as well.
Right.
So, what made you think, A, first of all, why do you think that this field is neglected? And B, what was your approach in terms of how to make this holistic? Because that's honestly the right way of doing it.
Right. So coming to your first question, while I was doing my MS, most of my colleagues, they wanted to be a laparoscopic surgeon, bariatric surgeon, some GI surgeon, neurosurgery, urosurgeries, cardiac surgeries, because they're all established areas of super specialty after doing surgery. Wherein
Right.
proctology was not an established area for super specialty. So I decided that, let's find out who is the best in the world. Then Dr. Antonio Longo was supposed to be godfather for
Okay.
proctology. He was based out of Italy.
Out of it.
I reached out to him while I was doing my residency, even
Okay.
before I passed my MS.
Yeah.
And then I got the opportunity to be with him for some time. And while I was doing that, I developed my interest toward proctology. And I realized that this is one segment wherein surgeons are not keen to offer minimally invasive treatment options. And
Okay.
people who are suffering from this disease, the pain is so bad. I'm giving you example.
Right.
I came across a patient in 2010 who was having chronic constipation and hemorrhoids. And he has already undergone bypass surgery. He was having diabetes, hypertension. He told me, the doctor, in Marathi language, he told me, Doctor, हृदयाचं दुखणं एकीकडं. Meaning the heart pain is aside,
Yeah.
but this bottom pain is worse than that.
Yeah.
So that's what actually hit me hard, and I realized that we should create more awareness in this segment and try to offer minimally invasive, painless solutions to patients suffering from piles and fissures and fistula.
Absolutely, yeah, right. Because actually, you don't realize it that a pain in the can really be a pain in the.
Yes.
So that's actually very insightful of you to look into that and then expand that to what it is today in terms of what healing hands is as well. But why do you think there is that? You were talking just before actually we got on screen, is that there's still a taboo or embarrassment that's attached to it because of people not wanting to come forward early enough and things like that.
I think that's a real one.
Yeah.
And it's not that only people from say a low socio-economic background or those who are not educated, they have this taboo. I see people across the segments when I come across doctors
Yeah.
who come to me, and when I ask them the history and all, they are saying they will usually say that I'm suffering from 5 years, 10 years. That's the kind of duration which they will talk about. Usually people don't talk about it for the reason it's a private part.
Yeah. Yeah.
While growing up, when you're with your GP, you usually talk about other things, like you talk about fever and all of that.
Right. Right. Right.
Even while taking history, if you go to a doctor, they'll ask you about history of, say, all other things, but usually people don't ask about constipation or, history of piles and
Yeah. Yeah. Good point.
so that's how it is kind of neglected within the medical community as well. Now, another thing is within the family also, I see sometimes I see couples coming to me for treatment, and when husband express that I'm having pain,
Yeah.
I'm bleeding for last 1 month, silently wife will say that I'm suffering from last 10 years.
Oh wow.
So that's the thing, and then husband is not aware of what is happening with the wife.
Right.
So I think a lot has to be done in terms of creating
Awareness. Yeah.
this segment.
Yeah. Which I know you do a lot also. Thank you for that. I suppose, yeah, coming to what you were talking about a little bit earlier, you said the word preventive. What are the kind of things that good habits or things that you would recommend to, prevent a lot of these ailments that you deal with?
So I think constipation is something which is a key factor for patients suffering from piles, fissures, and if constipation can be taken care of, that will prevent hemorrhoids or fissures. Now, constipation, again, the incidence is increasing. I mean, there was a time when I used to see people in the old age group with constipation.
Okay.
Now, I see a lot of younger population. I also see children suffering from constipation. So, I mean, a lot goes into it. Obviously, the fast life, fast foods, and we call it as classically as 3 Ps. A lot of preservatives
right.
and
Processed.
packaged food and processed food.
Yeah.
So these are the 3 Ps which are responsible for constipations. So I usually ask my patients to avoid this processed food, packaged food, and preserved food.
Yeah.
Second thing is food adulteration, which is also responsible for chronic constipation. Third thing is, sedentary lifestyle,
Yeah.
less intake of water. That also adds to constipation. So if one can take care of constipation, we can actually prevent
A
piles
lot
of
of these issues.
Another thing is that healthy lifestyle has to be followed, wherein one should try to avoid sugar as much as possible. One should be active in terms of, say, exercise, avoid using elevators wherever possible,
Yeah,
try to
yeah.
take the steps.
Right.
So all these things are missing in today's fast-moving world. So I think that is why the incidence is on the rise.
Fiber in your diet, I suppose, is a big one.
Fortunately for India,
Yeah, that's true.
our diet is that way balanced in fiber, so
Yeah.
it's not a challenge. But yes, global, it's a challenge.
Right. Yeah. Yeah. So, what are the other kind of good habits that we can try and adopt?
One thing, I mean, we did a study.
Right.
One thing is like one should avoid sitting in the washroom for long.
Sitting on the toilet. Yeah.
Yes.
Okay.
So, I mean, what we have seen is people who sit on the commode for long, they tend to develop hemorrhoids
Okay.
over a period of time.
And sorry to interrupt, Doc. What is hemorrhoids again for some of us that
It's
like
just-
neuros?
The files are also known as hemorrhoids.
Oh, I see. It's another word for the same. Okay, fine. Sorry. So you were saying about people who sit on the pot.
So, people do have tendency of sitting on the commode for long, like, carrying mobile.
Yeah. Now that's becoming a big thing. Now you take
Yes.
your iPad or you take your mobile and you realize you're just sitting there for watching an entire episode of a show or something.
Yes. So unknowingly, one spends more than 10, 15, 20 minutes, sometimes 40, 45 minutes for long.
Wow. Yeah.
And it's only when someone knocks on the door, you realize that it's time to come out. So that's one of the cause for piles at an early stage.
Okay. But why is that? Because people don't realize that they actually.
I think it's kind of me time, I mean,
No, but what causes it? Is it that people are sitting there and they don't realize that their muscles are tense or?
I think it's just, I mean, reading newspaper or being with the mobile distracts you from the act of bowel movement, which is supposed to be for 4-5 minutes.
Yeah.
And I mean, someone just keeps on sitting there for long, and that is what leads to weakness of this muscles within the mucosa, which leads to prolapse and files.
Okay. Interesting. So actually, that's a very good, very practical tip. People should just be aware of.
Yes, yes.
Just stay off the pot as much as
Yes,
possible.
yes, and this is supported with a very large study which we did
Right.
of more than 5,000 patients.
Of your own patients, you
Yes,
said. Yeah.
yes, yes.
Okay.
And we realized that more than 25% of the people, they tend to sit on the pot for almost more than 15 minutes.
Okay. Oh wow. That's quite something. Yeah, it's something I have to actually start thinking about now. It should be out in 4 to 5 minutes. Should people start setting alarms? What are the other kind of myths and things like that that people come to you and your first thing is like, this is, like a typical myth that people come across now on social media. What are the kind of myths that you think that you need to be
I mean,
busting?
there's a lot of fear. So one of the common symptoms is blood in the stool, and I see a lot of youngsters when they get fissures, which is like a streak of blood in the stool.
Mm-hmm.
They get freaked out and they think that it's a cancer or something.
Okay.
So people have this fear that if
Right.
there's blood in the stool, it can be cancer also.
Okay.
Yes, the risk of cancer is like anywhere between 5 to 10%. So it should not be ignored. But that's one thing which I mean people are really worried about when they come to me. Second thing is sometimes people ignore bottom diseases because they think it is piles.
Okay.
And there are a lot of over-the-counter treatment options which are available for piles. So someone will use cream, someone will use some kind of jadi booty, some kind of home remedies and all of that. But the actual disease is something different.
Right.
So eventually by the time they come to me, it's usually a fistula or something different when they have developed abscess, infection.
And then there has to be more intervention.
Yes, yes. And then they'll end up with intervention. Sometimes it is just fungal infection which is responsible for the itching, and they are being treated with steroid creams considering it is fissures.
Okay.
So in fact that aggravates the whole process of fungal infection.
Oh wow, yeah. So don't self-diagnose,
Yeah, definitely.
which is now also becoming a thing with
Yes.
Dr.
With the-
Google and AI and
with
so
the AI
forth.
and all, yeah, definitely.
Are you seeing that becoming more of a problem with people coming to you?
Definitely, I mean, more with the patients, wherein we advise surgical treatment. So at times, if a patient is in a grade 2 or grade 3 hemorrhoids, not responding to medications.
Yeah.
And if I advise them laser surgery, maybe they will come for follow-up after Google and all of them. They will say, doctor, these are the side effects with laser. Why not stapler for me?
Right.
Why not the open technique and all of this?
Right,
I think this is because of Google and AI.
Okay. Any interesting stories you'd like to share with with us about some patients that you've had and good outcomes or for that matter actually even stories that would help us in terms of awareness that you were talking about earlier?
Yes, I mean one rare condition which I am kind of I deal with and wherein we have expertise is a vaginal fistula.
Okay.
So what happens is sometimes after forceful vaginal delivery, the vaginal wall might get damaged.
Okay.
And that can lead to a rent in the vagina wherein a female will pass stools or gases through the vagina.
Right.
And this becomes a very challenging condition, kind of embarrassing condition. And the treatment options which are available in terms of medical science, they have high recurrence rate. So the recurrence rate is close to 40-50% after the surgery.
I
A
see.
lot of them come to me, they come with failed procedures.
Okay.
So there's a story of a female who came to me from Nagpur. So she underwent 4 surgeries for vaginal fistula after delivery of the baby.
Okay.
And now she was at a stage wherein passing stools from the vagina is still also considered as a taboo in certain societies.
Right.
And then husband was not willing to accept her anymore. And then she was separated.
Oh God.
And the family was like, unless and until you get this sorted, we can't accept you.
That's
The sad thing, but that's what I saw. And then I took that as a challenging case. And I offered her an innovative technique which we have developed for vaginal fistula.
right.
And luckily she got cured in 3 months' time.
Okay.
And she just came to me after surgery last month. And she told me that now she's again with the family. And the family accepted her and
Lovely.
she's back to things and the baby is happy.
Okay.
So that's something which gives us a lot of joy.
Absolutely, yeah.
For a very challenging condition.
Right. Absolutely.
Another case, if I have to add, is a boy who was suffering from complex fistula. He was kind of genius. He was 9th grade, and he was supposed to give his exam for 10th, wherein he wanted to be a doctor, he wanted to do MBBS and all, so he wanted to pursue biology after 10th.
Okay.
But then because of the fistula, he failed 8 surgeries before he came to me, and then the family decided that maybe he will not give the 10th exam and he will take a break and then he will give the exam again.
Okay.
But I was very persistent with the fact that I told the family that I will make sure that he is cured. Let him study. Let him
Right.
give the exams.
Okay.
And he was just cured a month before his exams, and he actually passed the exam with flying colors.
Okay.
When this boy,
Nice.
when he came to me for a follow up, he came with a nice greeting card.
Okay.
So I think that was a very
That was
touching
great.
moment, wherein he scored well, and now he is going to pursue MBBS. So his
Oh,
dream
good.
is going to come true.
Oh, good. I'm so happy to hear that. And that's a lovely story as well. Final question then for you, Doc. What does wellness mean to you?
So for me, I think wellness is something which is a state of happiness. I mean, one has to be happy to be fit. And wellness is also about eating healthy food,
Right.
regular exercise, and again in today's world, I'll say minimize your screen time. It's very important to be qualified for a wellness program. If
Right.
your screen time is more than 3-4 hours,
Yeah.
I think you are definitely distracted, and that will definitely take a toll on your health.
Okay.
So, and obviously early diagnosis,
Right.
prevention, all of that becomes part of wellness.
Mm.
But one has to maintain a balance of all these things to stay fit and then create happiness around. So even people who are working with you, your friends and all of them should be aware of what you are doing for wellness and try to spread wellness. That's what wellness mean to me.
Yeah, and with these kind of happy stories that you shared, hopefully that keeps translating for you at least. Or what do you do for your own happiness then? Let me ask you that.
So yeah, I mean, I love playing cricket. So
Okay.
I like to play sports. I love cycling.
Yeah, you can see that you're very fit.
And recently I started jogging, so
Okay.
that also helps me.
Good.
And I usually avoid food or drink or anything after 7 p.m. So
Well,
I
that's
try
another good
to
one.
maintain intermittent fasting for minimum 12 hours
Okay.
on an average.
You found that's been helpful to you?
It's
Have
helpful
you?
to me.
Yeah.
Yeah.
Like what are the benefits that you found for yourself?
I think you feel high on energy. I mean,
Oh, really?
first 6 to 12 weeks might be challenging if you're not into the habit of
Yeah.
intermittent fasting. But I think 12 hours is definitely proven, because
Yeah.
7 to 7 is something which a person can do easily.
Right.
It definitely helps. And also, it obviously helps with metabolism and everything.
Yeah. Okay. Well, Doc, it's been extremely insightful having you here and listening to all your insightful comments and stories and tips that you can give us, especially in a field as we talked about that is, as you said, neglected. So I think it's really important what you shared with us today, and especially in terms of what we can do on the preventive side, on the busting the myth side, and on all the tips that you had. So thank you so much for being here. We really appreciate that.
My pleasure. You've been doing a wonderful work. The moment I walked in, I could see a blend of wellness here
Thank
within
you.
your ambience. So it really reflects well about the work that you are doing. So all the best to you.
Thank you, Dr. Paula. That's very sweet of you to say. Thank you all, and look forward to joining for next week's episode. But before you do leave, do not forget to hit the like and subscribe button here at the bottom. If you have any comments, please do feel free to share it with us, and we will be happy to look into that and try and incorporate as much of that as we can. Thank you so much.